extreme weather here today in this Museum of Unnatural Disasters. I'm Dr. Mona Sarfati, most recently faculty at the George Mason University Center for Climate Change Communication. And some years ago, I started an organization of physicians that brings together physician groups from around the country to focus on the health impacts of climate change. And also at state level, physicians and other health workers and health professionals to focus on the climate impacts at the state level around the country. This event and the museum are very timely. Just a few days ago, DC was experiencing 90 plus degree weather. And of course, we're forecast to have more of that. And the air quality as a result went into the yellow and orange zones. And as many of you probably know, when heat and light act on the emissions in the air, like the vehicular emissions or smokestack emissions, it forms ozone. And ozone is an irritating gas that then irritates the eyes, it irritates the passages of the nose, and also the lungs. And so people who have an underlying problem like asthma or who are just sensitive to that, can end up really in distress. And emergency room visits go up, and sometimes hospitalizations occur as well. There are other people who are especially sensitive to those situations when they happen, and that includes young children. Young children spend more time outside. They breathe a little more than the rest of us because they're smaller, they breathe faster. And so it can affect young children, and it can even have long term impacts on the development and the neurodevelopment of those children. So, it's clear to me that as a health professional, that climate change is fueling a public health crisis, and people are not only enduring these traumatic events themselves, but also the chronic and long-term health impacts that come with heat waves and floods and storms and fires and floods. The health impacts are numerous, and we know from the increase in hospital admissions and emergency room visits during times of extreme heat or at the time of hurricanes or fires that these impacts are directly showing up in our health system. So the administration's attacks on climate and clean air protections are also endangering our health and our lives. As you probably have heard, they are stopping the measurement of the changes in the ocean. The oceans are heating up around the globe. And just this week, there was a decision to stop measuring the temperature deep in the oceans that would keep us aware of what's going on down there and help us figure out how we need to prepare. So during this discussion, we're going to examine the health impacts from extreme weather that millions of Americans are facing and the critical need to restore pollution protections that protect us all from these health harms and protect our vital atmosphere from warming up and being the underlying cause of what we're experiencing. As a backdrop to this discussion, the Museum of Unnatural Disasters features photographs, artifacts, and interactive exhibits that help you step into the lives of people who have experienced these extreme impacts, the extreme weather, and the way that they've disrupted people's lives. And if you take a look in there, you'll see some very common everyday objects, teacups, cheese graters, other things that people use every day in their kitchens and in their lives that reflect the way that these unnatural disasters have impacted people. So I want to take a moment to introduce our speakers. We have two members of Congress who were going to join us. It looks like actually we still have one member of Congress who's going to join us. Unfortunately, or maybe fortunately, it's turned into a heavy voting day in Congress. So they have a lot of things they have to weigh in on. And I was actually a staff member in the Senate for about 7 years on the Senate Health Committee. And so I know what that's like. And there really are a lot of demands that come sometimes unexpectedly. So Representative Jennifer McClellan, who represents Virginia's 4th District, will be here. And when she comes, I'll announce her arrival. She serves on the very important Energy and Commerce Committee. which has been a very vocal advocate for policies to address climate change and also policies that would protect mothers and children and future generations. We have with us Dr. Georges Benjamin, somebody I know very well. I've been a longtime member of the American Public Health Association, and Dr. Benjamin has been the president and CEO of that group for many years now, actually since 2002. And he's leading the association for a push to make the U.S. the healthiest nation that we can possibly be. And prior to APHA, Dr. Benjamin was also the lead health department head in the state of Maryland, which is where I currently live. We also were very fortunate to have with us today Steve Engelman, who teaches AP Environmental Science at Palisades Charter High School in Los Angeles. And he and his students lived through the disastrous fires that occurred in LA in 2025, and he knows very personally impact on mental health and physical health that this kind of experience has on young people. So actually, I'm going to turn to Steve Engelman first to get a very personal story about these situations. Thank you.
Okay. Thank you. So, yes, my name is Steve Engelman. I teach environmental science at Palisades Charter High School. I've been teaching there since the mid '90s, and even before the fires happened, just teaching environmental science in general can be really depressing. It's like chapter after chapter is like, oh boy, we messed up, and then next chapter, oh, and then we really messed up, and then it doesn't stop. And so and as a teacher, I look concerned that my kids are at some point, and they're teenagers. None of this is their fault. It's maybe blame their parents or their grandparents, but it's not their fault. And so in a teenager's brain, I think it's not too crazy for them to flip it off and say, well, I'm going to go play Fortnite and just forget about it and it'll be fine. And of course, if that's what happens, then all the worst things are really going to happen. And so one of my concerns, even again before the fires happened, is that it's just general climate anxiety. Is I get the kids and I try not to sugarcoat anything. I try to show them that we actually know what to do. We know how to solve these problems. We just need to do it. And a lot of them, you can just see, just have this climate anxiety where I've had a couple of kids who, after the first month, checked out of class and they told me it's not about you. It's just they're being depressed and the class is making them depressed. And so they'd rather not learn about it. And also I had actually a couple of students said that they're planning on not having children because that's almost like, actually, these are their words, it's almost considered child abuse to bring a kid into a world when they look at the politics and it's just not going fast enough. And so that's even before the fire's happening. And in high school age, teenager, they're going through a lot of stuff anyways as being a teenager, and then you throw the other stuff, AI and social media and all that on top of it. And then you start telling them about, the future of the climate. So that's a mental health thing that I think is really, really concerning. And then you throw fires on top of that. And, so we're a charter school, which means we get kids from a lot of different places. It's not just from the Palisades. And so there's a number of kids who lost their homes. There's a number of kids who didn't lose their home, but they had to evacuate and they were moved out for 6 months before they could move back in. Some of them didn't lose their house, but still have not moved back in just because the area around them is not that great. But then even the kids who didn't have a home in the area, we all went on Zoom for like 2 months or so, which, the COVID pandemic told us that that's a horrible way of doing education. And so some kids, their parents decided to check them out of the school and go to a different school just because they knew the quality was going to go down. then we moved into a department, an old Sears building in Santa Monica. Stayed there for about like almost a year. Um, I was in the basement where there's no windows, and none of the classrooms had doors. The lights didn't turn off. You could totally hear it. The teacher to the left and the right of you. And so, and a bunch of kids were expressing just like not feeling healthy in that environment. Um, and so there's a whole broad spectrum of mental health kind of issues that the kids are struggling with, on top of just the knowledge of what's going on with the climate. Because, and in many ways, I felt that we were living through the AP Environmental Science curriculum, um, very, very, very personally, literally, going through that. Um, but as definitely you can tell, like there's a lot of kids, just their mental health with being impacted. And actually, a student of mine, when I knew I was coming here, I kind of like asked a bunch of kids, like, what are your thoughts? And I was going to be talking on a panel here. And so one of the students actually sent me, I didn't even know he did this. He put a survey out to the students last year, with questions about their mental health. And so he gave me, well, I'm not going to read this whole thing, but there's a couple I would like to read. And these are just random students without names attached to them, talking about different ways that it impacted them. And so I'm just reading right here. Well, so there's one student said he's seen many fires in the past, but usually wasn't that concerned about it. But then when he saw the pallet highway being damaged, I realized that things may never be the same. Um, his parents made a decision to transfer him to a different school. He said, "This broke my heart. Having to transfer to schools made me lose the last part of my community that I could hold on to. I felt lost, anxious, and scared, feeling what might come next. For the first few months of my new school, my mental health was probably the lowest it had ever been. Every day being at a new school reminded me of the more stable life I could have had, if the fire had not taken that from me." We moved back onto the campus. And so now that we're back, and he's back on the campus too, says there's still, like every day at school, he's still, times when I'm sad and disappointed, wondering what could have been. So that was all just one student. And another one, says one of the strongest impacts of my life, um, was being forced to move school locations. At Sears, our temporary location, I became extremely depressed without being exposed to nature, and much of my classrooms, having no windows, which that was mine. The realities of the fire set in. I was excited to return to the main campus, although it was far better than being at Sears. Every single day that I would drive to or from school. I was reminded of the fires by the destruction of the Palisades. So outside of the school, it's like the coffee shops, the stores the kids would go to after school. Like none of that exists. So they just scoot off to, not hanging out with their friends like they used to. Um, I had an overwhelming feeling of loss. And just one more here. My experience with the Palisades fire was the most life altering thing I've ever been through. I lost my school. I lost my community. I watched everyone around me lose what they loved. My whole world was changed. I was unable to tell where, when he returned back, to the area. Says I was unable to tell where I was. All the landmarks were gone. And I never realized how much of the Palisades meant to me until, I was no longer in it. And so these are just a couple of students who express their things, and I've just seen a lot of it, at the high school where I've been teaching for 35 years, and and this has definitely impacted, their sense of security, because usually, these climate disasters are like in a different country or at least like a different state. And but like, and then it's like, right, your hills are on fire, your community's on fire. And so that was like, yeah, that was really big.
For that description. Um, it's a pretty graphic story about fire and the impact of fire. And if you have a chance to go into the museum, there's a tremendous amount there about, the after effects of a flood. So we know fires and floods, and we all watch the news as that area of rural North Carolina, not that far from here, suffered from the major flood at the time of the hurricane. And so the population in Los Angeles, the population in North Carolina, in the rural area. And now I'd like to turn to actually, I'd like to welcome first Representative McClellan. Thank you for being here. We look forward to hearing from you in just a few minutes. I'd like to turn to Dr. Benjamin, who, as a public health expert, thinks a great deal about communities and the impact on communities and low-income communities and communities of color as groups that are also disproportionately impacted by the consequences of extreme weather and climate change. So, would you talk to us a little bit about those impacts?
Sure. Thank you, Laura. Let me just remind folks that there's no question that climate change is here and it's impacting our health today. And we need to avoid trying to come up with strange words to describe climate change. Okay. It is climate change. It's not the weather. It is hot. It is getting hotter. The planet's getting warmer. And it has enormous impacts on human health. And in fact, I would argue that the heat is probably the worst of all of the unnatural disasters that we get. One of the reasons it's bad is because it's very deceptive. You know, when we have heat waves and it gets very hot, and yeah, we do tragically have a few people that go out and try to mow their grass, and we have a few people who die or have heart attacks and other problems when they get out in the heat. But it's never the one-day heat wave that causes us the problems. It's the people that show up on day 3 and day 4, and they don't just show up in the 1s or the 2s, they show up in the 20s and the 30s, or in the case of Chicago many years ago, in the thousands. And then they disproportionately impact people who are living in environments where they can't cool off. Now, I grew up in Chicago, and we were able to, working with the fire department, sometimes without the fire department, open the fire hydrants and cool ourselves off. But there were far too many people, particularly in the inner city, that live in these high-rise apartments, or they live in communities that are frankly high-crime communities, and the windows are shut tight. And of course, heat goes up. And so now you have seniors living in high-rise buildings where the heat's going up and they don't have air conditioning. The ones on the first floor or 2, the windows are shut and they don't have air conditioning. And it gets hot. And these are people who have mobility issues, they can't get around. We often don't have access to cool water. They are often on multiple medications. Sometimes you have patients that are on medications that impact their ability to sweat, diuretics, high blood pressure medications, people with diabetes. The point being that the health impact of the heat is enormous. And then we have things that Steve and his students have experienced, where you have a wildfire. And I remind you that the wildfires we had in Canada just last year resulted those of us in the Washington, D.C. area to actually close down. I actually had to close down the American Public Health Association because the air quality from wildfires in Canada was so bad that people couldn't come to work here in the Washington, D.C. area. So it is deceptive, it is deadly, and of course it disproportionately impacts people who are unable to protect themselves the most. If they're young, if they're old, the people who are resource constrained. In this country, that tends to be people that live in lower income communities, people of color. And the challenge is that we continue to put our heads in the sand. And we need to be very clear and very direct because it causes lives. It is not a benign condition. And just remind you that a wildfire is not like a campfire. It's not like some, little wood that's burning. When a community burns, it's not just the wood from the trees and the foliage that burns, but it's everything in that house that burns. The plastics, the building materials. These are very toxic combustibles that have enormous implications on human health. And again, because the air is the air, it's not constrained within a small area. It goes to miles. And so we have to pay a lot of attention to it and be more mindful of it. And one of the things that I'm glad we have a very esteemed member of Congress here with us, because we have people who are fighting the fight. And I want to thank you publicly for the work that you're doing on the committee and advocating for stronger health policies. And we need to continue to do more of that. So that when we stop and Mona, turn it back over to you to introduce.
I mentioned before that Representative McClellan is in the Energy and Commerce Committee, and he put forward a resolution last year to raise the alarm about the crisis, and especially about maternal and child health and well-being of mothers and children. So why are children and pregnant women so much at risk from climate change?
Thank you for the question for hosting this, and apologies for being late. We had votes that ran long because Speaker Johnson doesn't know how to count. But pregnant women and the infants and children generally are vulnerable to health impacts of our environment, including extreme heat and extreme weather. Um, children, and I'm a mom. So I'm a mom to two kids. When I was in the state legislature, I was the first member of the Virginia House of Delegates to be pregnant while in office. And that put me, my son turned 16 this year. So, and then I have an 11-year-old daughter. And so becoming a mother while I was already a policymaker has put me in a really interesting position to learn things that I probably wouldn't otherwise have paid attention to, like the fact that children breathe faster than adults. And so if you have wildfires and pollution as a result of them, they're breathing that in at a higher rate. And pregnant women, I don't know if, when you're literally carrying two human beings, that uses a lot more energy. And the hotter it is, the harder it is on your body to use that much more energy. You're more likely to get dehydrated, which if you're pregnant can be deadly. For infants can be deadly. They're more likely to get dehydrated. And then one of the things we don't think about that it really I focused on in drafting that resolution is when you're a parent, you want your kids to go outside. You want them to put the phone down and touch grass. Before that became slang. And yet if they're outside and they're on a playground and they're on playground equipment that burns them because it is too hot outside, or they're more likely to get sunburned, overheated, and have a heat stroke, then that makes it that much more difficult for you to create this space where they can be outside and play independently. And so these are some of the things, and then we haven't even gotten into the storms. The more extreme storms, the more whether it's more Category 5 hurricanes or tropical storms that are just much more deadly, and the impact that has on human lives. All of that makes it just that much more difficult to raise children and to be healthy when you are pregnant and trying to raise a child. So that's what prompted me to put that resolution in, because people oftentimes Congress will govern in silos, but we don't live in silos. So climate policy impacts education policy. If you're hot, you're probably not paying attention. As someone who went to a high school that didn't have air conditioning in the 80s, I can tell you there were lots of behavioral problems when kids were hot. The police often see in the summertime more fights and more violence when it's hot because it affects your mood, it affects your brain. So I think it was important to draw the connections between public health uh, and climate change. Um, I'll spare you the whole separate answer on national security and climate change, other than to say when I visited Naval Station Norfolk, which is the largest naval base in the world, and I asked the commanding officer what keeps you up at night, she said, every time it rains, there's a road that bisects the base, and I can't get from one side to another, and it's affecting, that affects our readiness. Well, it rains a lot more in Norfolk, and they get a lot more flooding and a lot more storm because of climate change. So every issue we care about, every aspect of our lives is impacted by climate change and more extreme weather.
Thank you. As you were describing that, I was thinking in Norfolk, and we talked about the sea level rise and how when the king tides happen, and I guess, over the cycle of the month, there are times when the moon pulls harder, and we have these larger tides. And she showed me a picture. In fact, I think I still have the little video on my phone of how the tide would cause flooding in the street right in front of her house. And if it was occurring on a Sunday, she wasn't able to get people to go to the church. And it was just a few years ago. It was really very surprising. So it's like a whole regular way of activities like that. But talk to me a little bit more about how this is affecting communities. And also, before we get totally depressed, I want everybody to remember that there are solutions. You know what the solutions are. And many of the people who focus on these issues here in DC are working for solutions. These solutions need more support and more people who know about it and who realize that they can make a difference. So, back to communities. That's about it. Anyway, actually,
Well, let me talk about some of the solutions. I mean, um, so obviously we've got to push back on some of the things that this administration has been doing. I think the fundamental one is we've got to reverse this crazy effort to undermine the endangerment finding. I think that's fundamental to us going forward. Um, and then I think obviously we need to begin doing things to again reducing our carbon footprint. Now we in the healthcare community use a lot of energy. In our systems, we spend a lot of money, time, and effort with materials that are absolutely essential to save lives. And we've got to find new ways to do it. As we modernize our healthcare facilities, we need to move to new, more modernized HVAC systems, power systems in all of our systems. We truly need to move much more rapidly to a green economy, particularly moving to hybrid electric solutions on our automobiles, much more quickly than we have. There's money to be made there. There's a monetization that has happened. We just have not yet had the political will to really push this out as quickly as we can. Clearly, smart surfaces. So those of you aren't aware what smart surfaces are, it turns out that if you go in most lower income communities, they're 10, 12 degrees hotter than our more affluent communities. And that's because we have more dark, impervious surfaces. We're out here, in Washington, D.C., and it's wonderful, wonderful green space, community that's walkable and bikeable and green. Well, our well-to-do communities look like this. Our lower income communities, the streets have been paved over, the grass has been paved over, they're hotter, there's more engagement, there's more violence. We can cool those communities by putting lighter colors on the roofs, digging up the tar, planting more trees, getting more green facilities, and that we can do right now. And we can reduce those communities' risk in a variety of ways. And by the way, um, because it's irritating every year, right? We know that the streets get re-torn up so they can repave them, and they pave them with the same dark, impervious surfaces. And I would argue for the base commander, if they were serious about fixing that road, there are new tools and new techniques they can use, as you know, to pave those roads with um, surfaces that actually handle the rainwater so it won't flood. And there are tools that we can use now to address those national security risks that we see. Again, though, we need to have an administration that is focused, wants to spend the money in the right place, and has an integrated policy solution to save lives. And I can tell you that from an advocacy perspective, I think most of us collectively are pushing really, really hard to try to make those things happen. And we're very pleased that members of Congress who are on the right side of this issue are waiting to help us do that.
So I'll take this opportunity to connect the dot a little further to the connection between climate change and national security and readiness. And it's a good example of the backlash that we're finding. So before being on the Energy and Commerce Committee, I was on the Armed Services Committee. And the Secretary of the Navy under President Biden, they did a whole report on the impact of climate change on readiness in the Navy. And Matt Gaetz, of all people, just went after him, saying like, this is ridiculous. Like the biggest threat is China or Russia or Korea, or like how can it be climate change? And the beauty of being one of the more junior members is I very quickly pulled up the report, and it's like, okay, try, imagine just, yes, it's hard enough being a civilian walking around in the heat, but try having to carry all of the gear and equipment that our service members have to carry in deserts. Try having to deal with the impact of corrosion on our ships and on our aircraft carriers, and try being on an aircraft carrier when you're overheated. So there's that impact. But then there's an economic impact. So I pulled a few numbers. In Virginia alone in 2024, there were 10 extreme weather events. Those 10 events caused over $1 billion in damage. And compared to that, before 2009, there was much, actually, I didn't get that. Before 2009, we averaged $1.4 billion events per year. But then an additional $1 billion more just based on the fact that there are more events. Now, that's a wide variety of things. It's from flooding, it's the impact on agriculture and crops, it's the impact on lost work days for people who are overheated and are sick, especially people who have to work outside. It's the higher healthcare costs because of people that need to go to the emergency room or get treatment for overheating or weather-related illnesses. And to piggyback on what the doctor said, it is low income and communities of color that are disproportionately impacted. I'll add to the things that low income communities have less of are trees. If we just planted more trees in inner cities, in the areas of the city where the lower income communities and low income housing, you could lower the temperature in that city and have a lot less of these problems. But now you add on top of this the impact that global warming has had, not just the warming of individual communities, but global warming on the number of communities that are being impacted. faster. And what is frustrating to me, particularly on the energy subcommittee, is when I hear my colleagues say, well, we got to win this race with China. We got to do this before China. It's like, you know what? It doesn't do us any good to win the energy race with China, to win energy independency, to win the AI race with China, if in the process we have less and less habitable land on the planet that leads to increases in migration patterns, that leads to increases in war over fewer usable resources. And they don't seem to make that connection. So I think a few of the things we're doing, other than just, it would take all day for me to list everything that the White House is doing. And we are pushing back through a wide variety of issues on everything from telling the EPA, just do your job and enforce the environmental protections that we have in place, many of which will prevent climate change. How about you don't fire the people who are supposed to be implementing it? How about you don't roll back every single protection that's been put in place for the last 50 years? How about you break this addiction to fossil fuel based energy when clean energy is the cheapest, cleanest, fastest energy to get on the grid? And oh, by the way, creates jobs. And there's a wide variety of bills and resolutions and letters and that we're doing. And I'm not going to tell you who to vote for because we're here in my official capacity. But these midterm elections have consequences for whether we continue this rollback or whether we rebuild and build on the progress that we were making before January 20th, 2025. Thank you.
Yeah, thank you very much for that. I wanted to talk a little bit about the healthcare system, but before I do, and while we still have Representative McClellan here, I wanted to ask, what do you see as things that families can do? They're facing not only the bill, the heat, the dangers of climate change, but also the economic consequences. They're worried about their children, they're worried about their elders, they're worried about those in the family who may have various medical conditions. What do you see that people can do to kind of protect themselves and their families and their communities?
Well, the first thing that comes to mind, the administration is trying to make harder, and that's weatherize your home. Whether it's trying to get more energy efficiency windows, whether it's replacing inefficient appliances. There were, and there still are, just they're trying to roll them all back now. Lots of grants and state, federal, mostly federally funded, but state and local grants to help people weatherize their homes to at least make your home a little more comfortable. That's the first thing that comes to mind. And I think kind of drawing on my childhood and Schoolhouse Rock, but not the one that you're thinking of, not the bill becomes a law, but anybody remember Energy Blues? When we leave here, but in the energy crisis in the 70s, this Energy Blues had lots of little tips for how to address the energy crisis, or as simple as like turn the lights off when you don't need them. Not only will that help conserve electricity, it'll keep your house a little bit cooler, like keep the blinds closed. Just little tricks to keep the sun out, keep the heat out, that most people just don't think to do, but it will impact how hot your house is on the inside, or just a couple of ways.
So earlier on, I talked about how environmental science is really depressing. And one of the things that I try to do is with my kids is I try to get them not depressed. And that's by and actually a little bit of encouragement is I try to give them a whole bunch of opportunities of engagement. Um, whether it's a beach cleanup or signing a petition or showing up to a rally or something like that. And for example, one of my students just last week emailed me, and he's graduated. He's not getting extra credit or anything for class, but he asked me, when's the next time they're going to be planting baby oaks in the Santa Monica Mountains, because he wants to be there. And I'm hearing from some of these people organizing the events that they're seeing a growing number of young people showing up. And I think it's part of they're recognizing that this is something that they need, and pulling out invasive plants or whatever. But then it's not just them; they have like another 20 people out there also taking their Saturday morning to do the same thing. And I think that's really encouraging. And kind of along those lines, and I didn't come up with this. Someone else, I forget who said this, but when asked like, what's the one thing you can do to help the environment, and they said like, stop acting like an individual, like join a group, find a community to be part of, and that's how you do so. And also, I'd like to say that, because again, one of the things I'm trying to talk back to my students, give them some hope. And one of the things I was hoping to find here is finding some examples of people in politics who are actually, know how to not just talk the talk, but actually do it. And, to give them hope that, there are some people out there who are doing the right thing. So that's hard right now.
Thank you for that. I would like to turn to Dr. Benjamin and ask him about health systems and what role these systems, such as accessible, affordable healthcare, play in keeping communities safe from these impacts.
Yeah, we as a nation continue to struggle with our healthcare system. We spend, as you know, over $5 trillion now. $5 trillion. And we are at the bottom in terms of health outcomes in the industrialized nations. And we really have to, once and for all, build a system with everyone in and no one out. Because when people are impacted by these impacts of health, climate change, they need to have the health care that they need. And we can't continue to put it off because it results in higher morbidity and mortality when we put that off. So part of really getting our hands around healthcare, of course, right now the issue of the day is affordability. Despite the guy that lives in the public housing across the street over here, pretending that public, affordability does not exist, it is a problem. It's the continued cost shift to out-of-pocket costs for individuals. Premiums are higher, co-payments are higher, deductibles are higher. The amount of money coming out of your paycheck every day is higher. And to the extent that climate change is occurring and people are being impacted medically from those changes, that means more visits to the emergency department for asthma. It means more visits for hypertension, for diabetes, for falls, for injury. It's really a significant issue. So we have a lot to work on, and understand that we have to connect the dots. This is part of the solution.
Which strategies like cooling centers and disaster recovery programs, and in that regard, I'd like to ask you all to think about the current policy which has led and encouraged FEMA to start only in states or work in states that have voted for the current administration. For most of us Americans who pay in their taxes and expect that federal emergency management agency will be available for growing networks. It's been really surprising that the services would be withheld from certain states just because they it's by the other party. So I'm quite sure
So I'm gonna have to leave as soon as I finish this, but I mean, it's viewpoint discrimination, plain and simple. To me, it's a violation of, First Amendment, like every right, basically, the First Amendment rights. And I'm waiting for the lawsuit that basically says the government is infringing on my First Amendment rights by withholding services based on, you know, my viewpoint, how I express myself, whether it's through the vote or things that I've said or things my governor has said or whatever. But it's unconscionable. I'm a huge history nerd, and the History Channel just finished this documentary about Franklin Roosevelt. And the, it's only really been since the response to the New Deal where the federal government shifted to care for people, help people and solve problems rather than to care for businesses. And a big part of what we see in this whole like make America great again is a desire to go back to this laissez-faire days where people just take care of themselves. Well, we never really lived in that world. We lived in a world where some people were able to take care of themselves and the vast majority weren't. And there was a lot of suffering as a result of it. And that's where they want us to go. And now we have the opportunity. We are celebrating 250 years of an idea that the power of government is derived from the people, not the other way around. Not and we have to decide by using our power whether we are going to continue to have a government that helps people and solve problems and addresses their needs, whether it is how do I respond to an emergency, how do I make sure that responding to a national disaster, because that document we're about to celebrate 250 years of, even though they meant men, and some men, not all men, but the idea was government is there to help preserve your ability to life, liberty, and the pursuit of happiness. That's not what they are doing. It is up to every single one of us this year and every year to decide, is that ideal worth fighting for? Is that ideal worth keeping? And what are we going to do about it? And with that, I got to. Okay, one more question, and then we'll call it a close. We'll call it to an end. And I want to encourage everybody, if you haven't had an opportunity to get into the museum itself yet, I definitely encourage you to do so. But I wanted to ask the panelists, and then maybe some of the audience too, if you want to share, what it is that gives you hope in this situation, which can feel bleak. And I think all of us are trying to figure out where the points of light and the points of hope are. And so I want to ask the panelists first, and then if anybody would like to share, we'd love to let comments.
As I was saying earlier, the thing that gives me hope is when there's community, when people show up, like at this event, for tree planting, for a beach cleanup, or whatever, and just seeing, people who are, they're not there for extra credit, they're not making money, they're just coming because that's what gives you hope.
And I having an audience in the middle of the week, on a granted not too hot but sunny day in Washington D.C. gives me hope that the advocacy isn't over, the fight isn't over.
Very good. I think we can all, resonate to those points of view. And does anybody else want to share something? If you don't, and that's been enough. It's been, really a pleasure to have you all here and to hear from our speakers. They're excellent speakers, and we're all, I think, hoping that things will move in a better direction. But I did see somebody raise their hand. Please go ahead.
Thanks. Hi, everybody. My name is Cheryl. Thank you so much. Coming from Phoenix, Arizona, which, as you all know, is notoriously super hot. And something that gives me hope is, so I got my master's degree in global technology and development, which revolves around climate change and the intersectionalities of human systems and the disparities and like just, yeah, history, cosmovision. Like my first class was why is the Amazon burning? And it was the social labs, it's interesting. But so I would say, I would like, I think that alone is like the education system is I think adjusting and there's a job market that's transitioning to that because we're being forced to. So I think that because there's different programs that are geared towards responsible innovation and solving these problems because it is dire. That's a source that gives me hope, but also the networks that across the country and across the world that are trying to solve this together with community and within community.
Okay, on that final note, thank you all for being here, and please do take a look inside the museum if you haven't yet.